Hi everyone, I'm Dr. Claudia Ruiz, an internal medicine doctor with a passion for educating and empowering you with helpful health information. So what are we going to talk about today? Today is a really important topic about mental health in the Latino Hispanic population, specifically post-COVID. All right, let's talk about an overview of who were mostly affected by the pandemic in regards to the mental health. According to the CDC, populations that were most affected were the young adults, Hispanic and Black persons, essential workers, unpaid caregivers for adults, and those receiving treatment for pre-existing psychiatric conditions. Suicidal thoughts in the Hispanic Latino population were 4 times more than the white population, so 22% versus 5%. And when we compare different groups, the Latino Hispanic population had higher rates of depression, 40%, in comparison to Black, which was 27.7%, and the white population was 25% during the pandemic. So let's talk about specifically the Latino Hispanic immigrant population in regards to mental health. There was a study conducted between the year of 2020 and 2022 regarding the mental health of the Latino Hispanic population. The results were about 60% of the Latino Hispanic immigrants had some sort of mental health symptom or disorder, including suicidal ideation, anxiety, depression, increased substance use, and COVID-related disorders, mental disorders. So what is the current mental health state of the Latino Hispanic population as of the most recent data? Approximately 22%, about 1 in 5 of Latino Hispanics have a mental illness. For serious mental illnesses, about 1 in 20. Yet, only 36% of Latino Hispanic population receive mental health services, as opposed to 50% of whites that receive mental health services. So there's a disparity there. Why is the Latino Hispanic population having the highest rate of mental health decline? The main answer is major psychological stressors. According to the National Institute of Mental Health, they reported that major life stressors such as trauma and stress significantly increased the risk of depression. They mention also that the Latino Hispanic population were more severely affected by these factors. So what are the psychological factors that we're talking about? It includes poverty. There are housing insecurity. Majority may have been essential workers. The rates of hospitalization and death of COVID-19 were approximately 3 times higher than the non-Latino white individuals. They had a higher risk of exposure due to living in larger, more compact homes, and also they've had some difficulty in maintaining optimal social density because of all these factors. Let's talk about treatment. What are the contributing factors that prevent our Latino Hispanic population receiving mental health services? These factors include socioeconomic factors, mental health care factors, and cultural factors. The socioeconomic factors, as we mentioned, low income, could also be that they were unemployed, uninsured. Lower education, may not know how to navigate the system, and immigration status. Federal and state policies have long excluded immigrants from many public benefits, including Medicaid and unemployed insurance. So what are the mental health care factors? Well, there is a shortage of bilingual or Spanish-speaking health professionals. A study conducted in the Latino Center for Health found that among board-certified Latino physicians in Washington state, only 3.1%, so 12 out of the 390 physicians reported to be in a psychiatry specialty. He reports that only 5% of the psychologists in the United States are Hispanic. And remember, U.S. Hispanic population is about 19%. The Latino Hispanic population are also more likely to seek mental health help from their primary care physician as opposed to a mental health specialist. What are the cultural factors that contribute to not receiving care? There could be medical mistrust, perceived or actual discrimination, language barriers, religious factors. Religion can be a protective factor for mental health, but can also contribute to the stigma against mental health, illness, and treatment. Another factor is attitudes towards mental health. There is a perception in the Latino health communities, especially among older people, that discussing problems with mental health can create embarrassment and shame among the family unit. Let's talk about culturally competent care. Previous studies have shown that using mental health interventions based on Western ideas might not work as well for ethnic minorities, leading to less involvement and worse results. Culturally tailored, adaptable mental health interventions are associated with greater symptom improvement among ethnic minorities. Culturally competent care, what does that look like? It's basically targeted efforts to a specific population. So language matching, resources in the Spanish language. Also ensure that mental health professionals are trained to address specific cultural and socioeconomic factors that are affecting Latino individuals. For example, training therapists values such as risk and small, which are common concepts in the Latino community. The long-term impact of these mental health challenges is still being understood, but it is clear that the pandemic has had a lasting effect on the mental health of the Latino population. Why is it so important to address this critical issue? Latinos are the fastest growing population. About 19% of the U.S. population is Latino Hispanic. By 2020, it's projected to increase to about 28% of the population in the U.S. This is over a quarter. What are the strategies to improve mental health in the Latino population? Of course, we talked about the culturally competent care, language matching, but there are other things such as reducing stigmas, community outreach and education, increase access to affordable care, increase research, policy changes, and expand telehealth and provide financial support. What are some of the challenges that I personally experienced as a primary care physician during the pandemic? In many cases, I've seen that patients presented with multiple physical symptoms that included tension, headaches, insomnia, stomach upset. After doing a full workup, the ultimate diagnosis was more of a mental health disorder that was contributing to all these symptoms. I did find that there were some quite hesitancy to seek therapy and prefer to depend on their family or religion. Spanish-speaking patients that did end up going to therapy decided to no longer go to therapy because of language barriers, not feeling understood. Even when used with a translator, it was difficult for them to feel properly heard and understood. I did see that my Latino, Hispanic, and Spanish-speaking population made regular visits with me to check up on their mental health and follow up, and really depended on me and chose not to pursue other mental health services. I did see a significant amount of patients not seeking medical treatment due to fear of exposure of COVID, which resulted in seeing more advanced cases of mental health disorders and, of course, medical disorders, and seeing them in more advanced stages. There you have it. This is the overview of the Latino Hispanic population mental health status post-COVID. Feel free to comment down below on your experience and any thoughts, insights that you may have, and subscribe if you want to learn more.